Well, it's that time of year again. Spring break is coming for so many families across Western Washington. If you are planning on traveling near or far this year, you do not want your vacation ruined by getting sick. So Dr. Ari Gilmore is here with Pacific Medical Centers to help us stay well. Let's talk about the Zika virus, because that's been a big deal the last few years. What's going on with that this year if people are traveling?
Yeah, it's out of the news, but it's not really gone. Most places that are pleasant, tropical, where you might want to be for vacation, probably still have some Zika virus.
So what are some areas we need to be concerned about?
Many areas in the Caribbean, throughout Southeast Asia, Vietnam, Cambodia, Central America, Costa Rica is a really popular destination. There's endemic Costa Rica and all those places.
Are there preparations or things people can do to avoid getting it?
You know, the thing with Zika is that if you get it, it's probably not that bad. It's really those repercussions for women who are planning on having children. And so the real big issue is for women who might become pregnant, not getting pregnant for 2 months after, not going during pregnancy. If a couple travels, really the recommendation now is 6 months, because if a man gets it, he can still be a carrier for quite some time afterwards. So,
all right, and the CDC has a lot of information on taking precautions as well. The norovirus. People around here, especially given our location, like to take cruises, right? I mean, it's great. It's an easy way to get out and see some of the beautiful area. But we often hear about people getting sick. So what do we need to know about food and water on ships?
Right, it's a really big issue. It's just so contagious.
Yeah.
The shipping industry does a really good job. They try not to let people serve themselves for those first few days on board. So following the directions, if you are ill, let them know you're sick. They'll bring food to you in your cabin. Wash your hands. If you have children and they're not feeling well or have symptoms, isolate them rapidly.
And it doesn't always come, we think water is the main source, but it's not always water that causes those stomach bugs.
For the more adventurous travel, if you're eating in restaurants, maybe in undeveloped countries, no, oftentimes it's the food itself. If it hasn't been processed from, the farm to the table properly. And so really paying attention to eating at nicer places. Whenever I go to a restaurant and I'm traveling, first thing I do, I go to the bathroom to wash my hands. If there's not soap and the bathroom's kind of spongy, then I'll be going to a different restaurant.
Oh, that's a good piece of advice. Okay, air travel. We're breathing that circulated kind of dirty air. What can we do on planes to make sure that we don't catch a bug?
Yeah, there are a couple things you can do. Try really hard not to touch your face too much. So every time you rub your eyes when you're tired, touch your nose, you're putting the viruses that are from common surfaces up there. Sitting near the window, turning the fan on so there's a positive air pressure across your face. Staying healthy, staying hydrated. Those can actually reduce the chance of getting ill. And
a lot of people like to have a drink on the flight to take the edge off, but that may not help you health-wise?
No, on a short flight, maybe it's okay, but the longer the flight, the more chance to start having a little adjustment to the altitude, and that's what causes a lot of those symptoms of jet lag, that extreme dehydration. So really, if you're going to be on a plane for 5 or more hours, I would skip the alcohol, hydrate aggressively, and you'll probably feel a lot better at your destination.
All right, all good advice. Safe travels for you and everyone else this spring break. Appreciate the information.
Well, after a week of